technically, and this is my the reason why I mentioned this, technically there is a distinction between international law and domestic law. And international law is something that binds states. Domestic law is something that binds individual citizens and organizations in those countries. So it's right to say it doesn't technically impinge upon our sovereignty because, firstly, it's not domestic law, and secondly, even if we made law, we could unmake it. But the reality is, if we were subject to a so-called recommendation, but a binding recommendation, which seems like a bit of a conflict in terms, but clearly the binding is meant to mean something. Firstly, there could be pressure on the United Kingdom by fines, perhaps by trading issues with other countries, because although it's outside the rubric of the WHO, there's no reason why other countries couldn't say, well, if you're transgressing international health restrictions, that's so serious that we're going to have trade consequences. But more to the point, and I think this is the more important point, we know the context in this country from the last 3 years and more generally of the pressure that builds upon a government and through that government, Parliament, because it controls the legislature, to do something, anything, if that is the something that everyone else is doing. And the helter-skelter in March 2020 was not just individuals, it was other governments. It was a pack of cards, it was a pack of dominoes all falling down, other than Sweden and one or two other countries. And the pressure was almost impossible, some would say impossible to resist. I don't think it was impossible. I don't think you can allow the government to get off the hook like that. But that's the context, and that's why it is so important. It's not just because of the technical, because it's a technical breach of sovereignty. It isn't, and it wouldn't, unlike membership of the EU, create a new legal order that bound the United Kingdom that we couldn't get out of. But it's the effect it will have in international law, and also the effect it will have on our governments through the pressure that will be created by the momentum towards new measures that the WHO wants.